Message President Obama has been repeating time and time again that the Romney-Ryan ticket will mean the end of Medicare.
Their plan ends Medicare as we know it. Governor Romney and Congressman Ryan want to give seniors a voucher to buy insurance on their own. Their plan replaces guaranteed Medicare benefits with a voucher that wouldn't keep up with costs.
But a leading physician says the president's health care plan is the one that will hurt seniors the most. So here to break it all down for us from New Orleans is the former American Medical Association president and the author of this book, The Little Red Book on Leadership Lessons, Dr. Donald Palmisano. Thank you so much, Dr. Palmisano, for being with us.
Thank you, Ainsley.
Well, you're welcome. Let's break this down. You say that Medicare will go bankrupt if we continue with Obamacare. Explain this.
Yes, in fact, you can get that information from the latest report, the Congressional Budget Office, the nonpartisan entity for Congress. And by 2022, Medicare will go bankrupt. It actually may go bankrupt before that because of the new health care law that the president is advocating, PPACA. And what will happen, we have 48 million people on Medicare now. By 2022, we will have then, 66 million. You can get those numbers out of the Congressional Budget Office. And the cost of Medicare at that point will go up it'll go up 90%. It will go up 90%. And so what you have then is a system that will fail. So the president says, keep this present system. Well, the system's not going to work. What we need, what the Romney-Ryan plan is saying, hey, we have to be fiscally responsible, and we're going to come up with a plan. Basically, who has this plan already? All the people in Congress, like the Federal Employees Health Benefit Program.
And
yes.
You also say loss of access to care.
Absolutely. You'll lose access to care because the physicians are price fixed with a formula called it's a bunch of jargon, the sustainable growth rate formula based on the gross domestic product. And so in the first quarter of next year, physicians are going to be cut 27%. Imagine all the small business folks watching this program right now, if you were told all your overhead's going to stay the same, but now you have to sell your product 27% less. And so doctors are getting out of the practice of medicine. Multiple surveys show that they're contemplating that, or they're restricting the patients they take. They're not taking new Medicare patients. That's not in the patient's best interest.
It's going to take a lot longer to get in with your doctor. And then the third point you made was no incentive to have real competition. Explain this.
Yes. In other words, what the Romney-Ryan plan does, the same thing that they have for the folks in Congress. You have an array of choices, perhaps 100 choices. So you get to pick and choose, as opposed to a centralized plan run by bureaucrats far away. And we also have this independent payment advisory board that's part of the new health care law that President Obama has advocated. And 15 bureaucrats are going to decide how much money to cut out of Medicare. And it's going to come out of physicians' payments. And so what you'll end up is loss of access to care. There's been so much misinformation. The president in 2009 said that surgeons get $30,000 to $50,000 for an amputation. That's why there's no incentive to save the leg. That is nonsense. And the president ought to fire the folks who are giving him that information. The American College of Surgeons put that up on their website.
I would hope a doctor wouldn't do that.
Well, absolutely. They get $740 to $1,140, and that includes 90 days of postoperative care. You can go to the American College of Surgeons website. They said it's misleading and dangerous talk.
Any doctor with a conscience wouldn't do that, so I hope that's not the case. Thanks so much, Dr. Palmisano. Thanks for being with us this morning. And your book, if you want to buy it, is The Little Red Book on Leadership Lessons. Have a good day.
Thank you very much.